Hi, my name is Maria Evanel Arnaveno and I will be performing medical hand washing. So the first thing we need to do is to prepare and assemble all the equipments and materials that we will be using, such as the bar soap, the paper towels, the faucet, the sink, and the running water. So this is done to save time and effort. The next thing we need to do is to prepare and completely assess our hands, fingers, and wrists. We need to remove all the jewelries on our hands because microorganisms lodge inside these jewelries, and by removing all our jewelries, we can properly clean our hands. Next is to ensure that our nails are kept short because short nails are less likely to harbor microorganisms, puncture a glove, and scratch a client. Then we should assess if our hands have cuts, open wounds, or breaks, and if they are visibly soiled because cuts harbor a high concentration of microorganisms, and if you have open sores, then you might need to change your work assignment and wear gloves. Then if your hands are visibly soiled, then you should take longer time to wash it. Next is to stand in front of the sink and keep your uniform and hands away from any of the sink surfaces because the sink is a contaminated area and you should not reach over it to avoid contaminating your hands. Next is to remember that if you touch any of the surfaces of the sink or even your uniform, then you should repeat the hand washing procedure. Next is to identify the different types of faucet controls. The first one is the hand-operated handles, such as this one. Then the foot pedals, the knee levers, the elbow controls, wherein we use our elbows to move the faucet, and the infrared controls, which detects movement. Then we should turn on the water and remember to use running water during the procedure because running water helps in rinsing the microorganisms and dirt away from our hands and into the sink. Then we should regulate the flow of water to keep the temperature warm because warm water removes less protective oil on our skin and cold water does not facilitate suds in cleaning. Furthermore, by regulating the flow of water, we can avoid the splashes of water onto our uniform which can contaminate the uniform because microorganisms tend to grow and move in moisture. Now that we have regulated the flow of water, we should now wet our hands thoroughly from the hands to the wrist area by holding them lower than the elbow so that the running water would flow from the wrist to the fingertips. Remember to keep your hands down and elbows up all throughout the procedure. So wetting our hands before applying soap is important because it facilitates removal of pathogens. Also, the water should flow from the least contaminated area to the most contaminated area, which are the hands. So this position permits cleaning the dirtiest area without contaminating the less dirty areas. Now that we've wet our hands thoroughly, we can now apply soap all over our hands. And make sure to cover all surfaces of the hands by firmly and vigorously rubbing the bar soap on our hands. So soap cleanses by emulsifying fats and oil and lowering surface tension. So before returning the soap to the dish, we should rinse it to remove any microorganisms. Now that our hands are covered with soap, we should now wash our hands and rub vigorously. Remember to keep your fingertips down and remove all microorganisms by using plenty of lather and friction for at least 5 times. Then all the following steps should occur for at least 15 to 30 seconds. However, the length of time for hand washing is determined by its degree of contamination. So the first step is palm to palm for 15 seconds. So rubbing and friction helps in mechanically removing or loosening the dirt, the bacteria, and the microorganisms on our hands. Next is the right palm over the left dorsum and vice versa. Next is palm to palm with fingers interlaced. So interlacing your fingers ensures that all the interdigital spaces of our hands are also cleaned during the procedure. Next is the back of the fingers to the opposing palm with fingers interlocked. Next is rotational rubbing backwards of the left thumb clasped in the right palm and vice versa. So rotational or circular movements or motions help in mechanically removing or loosening the dirt and microorganisms away from our hands. Next is rotational rubbing backwards and forwards of the clasped fingers of the right hand in the left palm and vice versa. So this ensures that our fingertips and fingernails are also cleaned during the hand washing. Lastly, if our hands are not visibly soiled, then we should wash 1 inch above our wrist. Now that we've washed our hands thoroughly, we should now rinse our hands thoroughly, starting from the fingers to the wrist area, and remember to keep your hands down and your elbows up. So rinsing under running water helps in mechanically washing away the microorganisms and dirt from our hands. Again, the water should flow from the least contaminated area to the most contaminated area. Now that our hands are washed thoroughly or rinsed thoroughly, we can now pat dry it thoroughly using a paper towel, starting from the fingertips to the fingertips where it is the most clean area, to the wrists, then to the forearms where it is the least clean area. So we should do this without rubbing the tissue or the paper towel on our hands. So just pat it. So drying prevents roughened skin or chapped skin, and moist skin chaps readily as it dry skin that is rubbed vigorously. So chapped skin also produces lesions. Now that we've pat dried our hands thoroughly, we should now discard the paper towels that we used in its proper receptacle to prevent the transfer or the transmission of microorganisms. So, clean towels and dry towels can also be used to prevent the transmission of microorganisms from one hand to the other. Lastly, we should now turn off the faucet by using a paper towel as a barrier between our hands and the faucet control to prevent the transmission of microorganisms from the faucet control to our clean hands. Again, we should observe proper disposal of the paper towel that we used. So that is all for medical hand washing. Again, my name is Maria Evanel Arnoveno. Thank you for watching.